Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Edo State government appeals to residents to avoid large gatherings, says third wave is twice as deadly as the second. And more states progress with second phase vaccinations. And Italy becomes the first country to insist on proof of vaccination, recent recovery from COVID-19 or negative test. And according to the Nigeria Center for Disease Control (NCDC), Lagos State, the Federal Capital Territory, and Rivers conducted the highest test of 19,830, 10,000 and 7,674 samples in the last 1 week from a total of 56,066 tests, both conducted using the PCR and the RDT rapid diagnostic tests. The agency, in its weekly report, week 36, also shows the number of discharge cases decreased to 1,880 from 6,246 in week 35. These were reported in 19 states and the FCT. However, there were 46 deaths reported in the last 1 week. Let's see the latest updates from the situation from last night.
601 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 16 states and the FCT, indicating a significant rise from the figures reported earlier. Lagos, the epicenter of the disease, had the highest figures with 173 cases. 97 cases were recorded in Edo State. The FCT had 68, Rivers had 50, while 45 cases were recorded in Delta. Kaduna and Edo States recorded 28 cases each. Akwa Ibom had 25. Bayelsa and Imo State had 16 cases. Plateau had 15. Anambra 12. Ekiti recorded 11 cases. Cross River and Oyo State had 6 cases each, while Gombe and Benue had 3 and 2 cases respectively. Cases for Akwa Ibom and Kaduna states reflect backlogs from the previous days. The overall count of confirmed cases in Nigeria now stands at 200,957. 429 recoveries have increased the total to 189,346. 7 additional deaths from COVID-19 complications have raised the fatality toll to 2,647. There are currently more than 8,000 active cases in Nigeria, while over 2.9 million samples have been tested so far. Over 4 million eligible Nigerians targeted for COVID-19 vaccination have been reached with the first dose, while over 1.7 million persons have been fully vaccinated so far. In Africa, there are more than 8 million confirmed cases and over 205,000 deaths recorded across countries on the continent. Globally, there are more than 227 million confirmed cases of COVID-19, while more than 4.6 million deaths have been reported.
And the Edo State government says the third wave of the coronavirus has been proven to be twice more deadly than the second. According to statistics from the COVID-19 response team, 59 deaths have been recorded till date compared to 23 deaths within the same period during the second wave of the pandemic. The permanent secretary, Edo State Ministry of Health, disclosed this during the daily COVID-19 briefing at the government house, advised residents to continue to observe the preventive guidelines, including avoiding large social gatherings, especially during the weekend.
More deaths are occurring during this third wave for the same period of time, virtually over ×2 the number of deaths we encountered during the second wave. That tells that there is actually serious need for us to step up our game in terms of preventing the spread of this virus. And it actually informs us again that this third wave is more deadly than we had in the first and second waves. So our appeal, again, is for us to observe the non-pharmaceutical measures that have been put in place by ensuring that we avoid crowded locations. This is important, particularly now as we are moving into another weekend when activities of various celebrations are at top levels in the state. We are begging and encouraging people to use their face mask, wash your hands regularly under running water, use the hand sanitizer when possible, maintain social distance when you are in a location where others are, and when it is not necessary, avoid going to locations that you must not go to. For instance, if it is not absolutely necessary that you attend a social function, avoid it so that you can stay alive.
Let's go over to Kano State, a state that has confirmed over 4,000 cases of COVID-19 and 1,112 deaths, which have been registered since the COVID-19 pandemic outbreak in 2020. The state government continues on the path of putting in place all measures to keep the state safe, especially considering that Kano is one of the most populated in the country. Head of the COVID-19 task force in Kano State gives the recent statistics in the state on the present administration of the AstraZeneca and Moderna vaccines.
On 28th of August 2021, we received Moderna brand of the COVID-19 vaccine, which totals 139,608 doses. This 139,608 doses of Moderna vaccine comprises of both the first and the second shot. Remember that for most of the COVID-19 vaccination, one receives them 2 times. The first one receives, and after an interval of say 4 weeks, between 4 to 6 weeks, one receives the second dose. So for the 139 is actually for both first and the second dose vaccination. Sites have been vaccinating people since the 28th of August 2001, and so far we have inoculated, or we have vaccinated a total of 59,190 over this period of time.
And over 29,000 persons have received the first dose of the Moderna COVID-19 vaccines in Adamawa State out of the 71,000 doses allocated. This was made known by the Director of Immunization and Disease Control in Adamawa State's Primary Healthcare Development Agency in Yola. According to him, as soon as the state government received the Moderna COVID-19 vaccines, it was the new vaccine that was allocated to the state, and the exercise is still ongoing across 21 local government areas, and he says that community mobilization is also ongoing. Some of the health workers deployed for the exercise have taken their doses, and they always say, of course, that they're part of those sensitizing citizens or residents there on vaccine hesitancy.
We are the front line that we received the injection, and we are fine. Although some tell me in less than 2 months I will die, and I'm still alive. I did not die. They should come for their own vaccine. It's very good, and it's good for their own health.
I'm appealing to people to go and collect their vaccine as soon as possible, because there is no any problem. As people used to tell that there is problem, no any problem.
The response has been quite okay. From the first, the governor of Adamawa State received this vaccine in a public hospital. This is something that is rarely demonstrated by leaders, but he demonstrated this by coming out to a government facility where he was vaccinated. So that actually informed people that these vaccines are actually safe. If such individuals, community leaders, leadership in all our sectors who avail themselves for this vaccination in a public hospital has actually contributed a lot to inform people that they need to come out and have this vaccination exercise.
So health workers also sensitizing residents there on the vaccination uptake. Well, joining us is a Dr. Stephen John. He tells us more about the vaccination ongoing in Adamawa State, even though he's joining us from Gombe. Thank you for joining us on the program.
You're welcome.
So tell us about vaccination progressing in Adamawa and also vaccine hesitancy. Is that much of a problem there?
Yeah, not as it was the first time we had an interface with you guys. Then vaccine hesitancy was a more serious issue, and but after the intensified risk communication activities and awareness creation alongside, you can see from the responses that people are given, they are actually satisfied. But that is not to say we still don't have issues, and of course, as a means of making sure we become more effective with deployment of this vaccine, getting it to the people that are required to be vaccinated. Mobile teams have been set up now. We use more mobile teams. We have about 71 of such vaccination teams. 30 of them are mobile, 41 of them are stationary. The mobile teams are targeting places like mosques, churches, markets, and public gatherings where people are congregating, whereas the stationary teams are located in primary and secondary healthcare facilities. So this way we are able to reach more people, and then with a little problem of vaccine hesitancy.
How much more sensitization is also going into the doses that are required and the difference if you've taken the AstraZeneca, how you have to take a second dose of the same vaccine, and then the same goes for the Moderna vaccine?
Yeah, certainly. Of course, it has been shown already that these vaccines have to be like in 2 doses. But what we are doing to make sure that we don't run into problems is that after the doses are being delivered, we make sure that we don't go beyond half of the doses on ground, so that you can make room for the people to come back for their second doses. As you're aware, Moderna is already like 4 weeks apart, and then we have the AZ to be something like 6 weeks apart. So we're making sure that we have enough, at least, to make sure that some people are not left hanging.
Tell us about perhaps hard-to-reach areas, and are you depending on the mobile teams as well to access those places, or have you also received the Johnson & Johnson doses?
No. We're depending on the mobile teams actually to reach difficult areas, because the stationary teams are located in strategic areas where there are a lot of people. People have access to them easily, whereas the mobile team are going to more difficult, even hard to reach areas in some instances. Like a couple of weeks ago, we were in a facility to do a kind of ceremony, like a block rain ceremony for a new cottage hospital. And the vaccination teams showed up there. And that's like 2 hours from the state capital into a very, very, very remote community. So that is to say that these mobile teams are actually trying their best to reach the most difficult of places to ensure that the people receive this vaccine.
So far, the first phase and now that is ongoing, what are the sorts of side effects that you've encountered or you've witnessed from those who are getting the doses?
Not much, just the basic side effects of maybe pains at the site of the vaccination. And a few people have reported a fever. I have a couple of friends that said, oh, they felt a bit feverish, but that was all. There was nothing more. But most of the people had no complaints whatsoever.
Going forward, and this is also so that you exhaust the 71,000 that you have right now, the state is currently 29,000. How would you say, what further steps do you think the state government, the primary healthcare development agency should take so that, the vaccines don't go to waste?
Yeah, what is happening now is that the vaccination program has been fully integrated into our outbreak response and also our other PHC responses. As I'm speaking right now, there are people in the field that are attending to other conditions like the other outbreaks that you hear about. They are also moving together with these vaccination teams. This will make sure that we're able to cover more grounds within the shortest possible time. And this flexibility provided by the mobile team is one of the solutions to this difficulty that will arise if we are a bit dormant, not being proactive enough. So this is the strategy that we're using at the moment.
We'll continue to follow the updates. We appreciate your time, Dr. Stephen John, for joining us all the way from Gombe State. Thank you.
You're welcome.
Still ahead on the program, prices for PCR tests are slashed ahead of the Expo 2020 in Dubai. Please join us again. Welcome back. Ahead of Expo 2020 opening ceremony, authorities in Dubai, the host city, say safety will be top priority and have now announced free PCR tests for all Expo visitors aged 18 and over. They're also expected to be either vaccinated against COVID-19 or have a negative PCR test result taken within 72 hours. Also, prices for PCR tests have been slashed across the country, one of the measures taken to ensure more testing. Our correspondent Maya Wadeguke has more.
A UAE government survey reports residents' confidence in the country's handling of the COVID-19 pandemic and efforts to return to normal is increasing. There has been a steady decline in new daily infections. The UAE on Wednesday recorded 608 new cases, its lowest record in the past year.
Over 80% of the population is fully vaccinated, and over 91.23% have received at least the first vaccines, or had over 18.9 million doses given, which round about over 7.82 million fully vaccinated doses given as well. So certainly quite a leap with respect to vaccination in the country. And again, our numbers, our COVID-19 numbers are consistently seeing a decline.
With the World Expo 2020 a few days away, the dip in numbers is expected to also boost travel and tourism in the country.
Unfortunately, this pandemic has created a polarizing society, especially in the States, where there's half of the population feels COVID may not be real, the other half is incredibly safe, and therefore that creates more numbers, more cases. Whereas in the UAE, it does seem like that there is a bit more unity, so I'm not surprised that the numbers are at a very all-time low.
One of the most important things when it comes to public health crises or public health matters is the government's posture. And the government of the UAE have shown that they have the right posture around the COVID-19 pandemic. For example, some of the top countries where the UAE used to receive visitors from, for a while they stopped receiving visitors from those countries. Countries like India, like Pakistan, we know there are so many Indians and Pakistanis, but for a while they were not able to come into the country. African countries as well, simply because of the COVID numbers there. So if the government can have that sort of attitude of putting the public health above its quest for income or quest for tourism numbers, increases the confidence that we have.
Local authority has also announced free COVID tests for all vaccinated students and educational staff every 30 days, while prices for PCR tests have been slashed to 50 dirhams from 150 dirhams. A welcome development, particularly for those who are unvaccinated and need to test more often than others. From Dubai in the United Arab Emirates, Maya Wadeguke for Channels Television News.
And away from the UAE, European Commission President Ursula von der Leyen has pledged to make getting vaccines to the rest of the world the bloc's top priority. Inside the EU, most countries have reached their goal of vaccinating 70% of adults by the end of summer. But big discrepancies remain. Joining us right now, DW correspondent Chelsea Dulani. Hi, Chelsea. The EU promised to give 200 million vaccine doses to low-income countries. Will that make a difference with the global vaccine shortage?
So in the broader scheme of things, it is a drop in the bucket. It's estimated that we need 10 billion more vaccines to reach global herd immunity, and that's the level at which enough people are vaccinated or have immunity that the virus is no longer such a risk. So 200 million is not going to vaccinate the world, but it can help, especially for countries that have yet to receive any vaccine doses. And that's on top of 250 million doses that the EU has already promised to low-income countries. But there is a major caveat, which is that the EU has not really kept up on those promises so far. It's only sent about 9% of those doses it's pledged to send by the end of this year so far. So we heard from the head of the organization Doctors Without Borders this week, the gap between these beautiful words and its actions is embarrassingly wide.
The EU seems to have plenty of vaccines, but there are still major discrepancies in vaccination rates among the EU members. So who's in the lead and why?
Well, in the lead is definitely the wealthier Northern European countries. Norway, Denmark, as well as Ireland are approaching 80 to 90% of adults vaccinated. The laggards are Eastern Europe. There is a very clear East-West divide in the vaccination effort here. In Bulgaria, about 20% of adults have been vaccinated. In Romania, 30%. And there are demographic factors at play. These are generally poor, less educated populations as well, potentially less access to unbiased media and a lot of distrust of state institutions. And all of that has meant that even though these countries have vaccines, people just won't take them. But even in Germany, we're facing similar problems. There are still many people who don't want to get vaccinated or are refusing. So this week, Germany has been trying to breathe some life back into this vaccine effort, especially ahead of the winter months when infections will likely rise, by making vaccines basically as accessible as possible. They're setting up vaccine drives at sporting events, at gyms, at pharmacies. So authorities are hoping that they will be able to raise the vaccination rate, though it likely won't do much to change the minds of the people who are ideologically against vaccinations.
We also understand that the EU also pledged 30 billion euros to fund a new emergency health agency to better prepare for crises like the next pandemic. How will they do that?
Well, this new agency will have two goals. The first is preparing for a future pandemic or health emergency. We've probably all heard by now experts saying that this will not be our last pandemic. So this agency will be in charge of, for example, stockpiling medical gear, masks, glass vaccine vials. This is really a response to what we saw during the early days of the pandemic, where Europe was very dependent on other countries like China or others in Asia for medical equipment, and they want to change that. It will also be in charge of making sure that Europe has production lines set up so that if an emergency does hit, it can scale up production of medicine or another vaccine very quickly. It's also going to be coordinating investment into research, for example, in technologies like the mRNA vaccine that was produced here in Germany. And the other goal will be crisis response. So when a crisis hits, this agency will help coordinate the strategies of the different EU members. So even though EU countries are responsible for their own national health policies, what we've seen throughout the pandemic is a sort of try-as-we-go approach to an EU-wide response, and that's caused a lot of confusion and chaos. So having this EU body will hopefully prevent that in future crises.
DW correspondent Chelsea Delany joining us from Berlin with the latest. Thank you, Chelsea. And employees in Italy could face suspension without pay for failing to show a COVID-19 green pass. Plus, in Australia, officials are moving towards reopening the country's borders for the first time since March 2020. Here's more on the global update.
Italy has become the first country in Europe to require all workers in both public and private sector to show proof of vaccination, a negative test or a recent recovery from COVID-19. The law, which penalizes anyone who fails to present a valid health certificate or green pass, will come into effect on October 15th. Workers will face fines of up to 1,500 euros for failure to produce the pass, while the employers can be fined up to 1,000 euros. Cambodia has started its vaccination exercise for children aged between 6 to 12 years old, in a bid to reopen the country to foreign tourists and all the schools for its 1.8 million youth population. Prime Minister Hun Sen unveiled the campaign with his grandchildren and young family members of other senior officials being given their shots. Nearly 72% of Cambodia's almost 17 million people have received at least one COVID-19 shot since vaccinations began in February, mostly with China's Sinovac and Sinopharm vaccines. Over in Australia, the country is looking to reopen its borders, which have been shut since March 2020. Prime Minister Scott Morrison says officials will trial a home quarantine system for international travellers arriving in Sydney.
We are now finalising arrangements that
Meanwhile, New Zealand has extended its pause on the travel bubble with Australia for at least another 8 weeks. The so-called Trans-Tasman bubble began in April and allowed Australians and New Zealanders to travel between the two countries without the need to quarantine. It was paused in July as Australia struggled to contain new outbreaks fueled by the highly contagious Delta variant.
Well, take responsibility to protect those around you from the risk of getting infected with COVID-19. Wear a face mask properly covering your nose and mouth in public places. It protects you and everyone around. You can take a look at our website. It has more updates, breaking news and several other stories at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.